to another Facebook Live, Lunch and Learn with the Center for African American Health. Today our topic is keeping kids mentally and physically healthy this summer. We want to thank our speakers who are Dr. Gayle Hamlett and Dr. Brandi Freeman. But before we get to that, I want to introduce myself, and I am Yolanda Gotier, and I am the Senior Living Health and Wellness Navigator at the Center for African American Health. For those of you who may be unfamiliar with the work that we do, we have been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. And we offer community-based, evidence-based disease prevention and disease management programs, events, and services. You can always learn more about our work and our programs by visiting the website at caahealth.org. Today, as I said previously, we are pleased to have two individuals participate in our Lunch and Learn series about keeping our kids healthy and safe this summer. So hopefully you as parents will not hear, "I'm bored," or "I don't know, when are we gonna get to go outside?" So we've got two individuals who are really good at answering those questions and helping us to be creative with our responses for our children. With us today, we have Dr. Gayle Hamlett, a longtime licensed school psychologist, and Dr. Brandi Kaye Freeman, a pediatrician at the Children's Hospital of Colorado. Both have some very impressive credentials, and perhaps most importantly, which definitely is important for me, is they have an extreme passion for children. As we move through today's session, please feel free to type in your questions and we will address them if time permits. So with that, let us go on and move forward with our questions. And Dr. Freeman, why don't you begin?
Good afternoon, everyone. It's great to be here. Thank you for having me. I think to get started, one of the things I think we have to think about this summer, in different to all other summers, is the COVID-19 pandemic. I've gotten questions from a lot of patients on, is that over? Do I need to really be taking precautions? And the answer is yes. The virus is not gone. We are still seeing cases. And so it's really important that we not only continue with the precautions that have been recommended in terms of washing our hands, wearing facial coverings, social distancing, but really not ignoring the fact that this virus is still here, and while we may have tried to forget about it, it has not forgotten about us.
Okay. As you know, the center is partnered with other organizations and the city to offer free testing. In fact, we have another COVID testing event on Tuesday, June 23rd at our location at 3350 Hudson Street. So if someone gets a negative COVID test, what does that really mean?
So what that means is that you are negative at that point. So the test was not able to detect virus at a certain level. So it's important to note that these tests need the virus to be at a certain level in order to be able to detect it. It does not mean you have not had, that you haven't had it previously. It does not mean that you cannot catch it as soon as you walk outside the building. It's important, if you're feeling sick, to understand, to have yourself tested, to know about the needs to quarantine yourself, and other precautions that you should take if you are positive. But a negative test is not, a free pass to do anything that you want. It just is specific for that time period.
Okay. What happens if, let's say, I'll use myself as an example. I test negative, but my child tests positive. Do I need to self-quarantine? And how do I do that with a 6-year-old, let's say?
Definitely. I think that's a question that a lot of families have had to deal with. So I think if possible, it is a great time to call in your support system. And if you are able to self-quarantine, however, if it's the child who's positive and they can't take care of themselves, using as precautions that you have available to you, using face coverings, washing hands, trying to make sure that the child is quarantining themselves so that they're not able to infect other people, and really listening, watching them for any complications that they have, whether it's in children, we've seen things like rashes, and not necessarily the severe respiratory things that have been seen in adults, but watching for those other symptoms and reaching out to your doctor for help if you are seeing any of those complications.
Okay, so we have one question coming in with regard to the testing, and that question is, do you have to have symptoms in order to be tested?
So the recommendation, the test we know is more likely to give you an accurate result if you have symptoms. So these are things like fever and the upper respiratory symptoms that have been described with COVID. Most testing centers are asking, are you symptomatic prior to testing? However, there have been other situations, for example, prior to an elective procedure, or also for mothers prior to giving birth, where people who have been tested who have not had symptoms have been found to be positive or negative. So most cases, the recommendation is that if you're going to take yourself to be tested, that yes, you should have symptoms. If you are having other elective procedures and that sort of thing, you may be asked to be tested in order to have a better understanding of the precautions that need to be taken.
Okay. And with the focus on COVID-19, I mean, we're really just sometimes forgetting about other health issues that might be out there. And so what are some of the other things that could impact our child's health over the summer?
Yeah, so I think every summer there's certain viruses that love to pop up. So hand, foot, mouth is one of those. Always taking precautions from the sun is a really important thing in terms of using sunscreen. Often African Americans, we don't always think about using sunscreen, but it's really important for all of us in Colorado because skin cancer can cause some very bad long-term effects later on. Thinking about things, I've been seeing a lot of patients with allergy symptoms. We've had a fairly dry spring for us. I think that has created a lot more aerosolized allergens, and thinking about how do you manage those symptoms for your best health to make sure that you can enjoy the summer as much as you can.
Okay, and do you think that because of COVID and children not being out and about as much, that we still need to be worrying about broken bones over the summer?
100%. I think one of the things that we see with children is that they do get bored easily. So whether it is they're just being active outside or they're finding new ways to be active inside the house, thinking about the precautions that we need to take from a physical standpoint, for toddlers, safety proofing houses, for older kindergarten or school-age children and on up, thinking about their imagination and how they can just find other things that maybe as an adult we would not recognize might seem fun. But really taking those precautions for safety, bicycling, making sure that everyone has a helmet when they're bicycling. I think that's a really important thing. And as we're trying to get kids out as much as possible, making sure we're taking those precautions is really important.
Okay, and I know that you've probably mentioned this already, but how early should my child start wearing a mask?
So under the age of 2, they are not recommended. Above the age of 2 years, masks are recommended for children. This is because one, developmentally, they'll hopefully be able to keep it on a little bit better. And then 2, they're able to communicate if they were having, where we're not going to be obstructing their airways and that sort of thing over that age. With masks, I think definitely also important to think about the type of mask. A child does not need to have on a big respirator or the N95s that have been kind of seen all over the place. I think really just thinking about a basic face covering to protect them from exposing people to their cough and then getting the call from somebody else.
Okay. Well, thank you. So now we're going to move on to Dr. Hamlett, and we definitely want you to stay on, Dr. Freeman, because there will probably be more questions. And Dr. Hamlett, if you would please give us just a mental health overview. I think oftentimes when we're talking about our children, we just see them and we believe that they feel okay and they look okay, so everything must be right. And, I think the other part is that with youth, we always hope that they don't have any worries. And we sometimes don't venture into asking, just tell me how you really feel with our children. So if you wouldn't mind giving us a little overview about children's mental health.
Well, I want to talk about this mainly. This is not ordinary time. And the way we find out how our children are feeling is what they say to us. And we also have to confirm the reality that the world is upside down right now. And everything is all confusing. This is the only time ever that the whole world has stopped. And you have to start with the pandemic, because children lost what was normal and usual. When you don't go to school, when your mom and dad aren't going to work, when you're told that you got to stay in the house, that can be scary. And you have to acknowledge that with our children. I would like to share just some of the feelings that I've heard from children, mainly from my grandchildren, and other children that I have talked to their parents here and there. And this is a time of confusion. So there was fear initially. I remember my grandson, he was afraid to come near me because he didn't know what was this virus was, and he couldn't hug me. And so he was standing back, and I said, oh my goodness. And I had been in quarantine, and then we decided we would gradually get used to each other. So we did the 3 weeks, okay? And all he wanted to do gradually, he said, I want to hug my Gigi. So there's feelings of fear, there's feelings of anxiety. And then here comes the video. Here comes the protests. And everyone had a feeling of outrage. So children are picking up what they're hearing and feeling from us and from all around us. There was also feelings of outrage, and this is developmental, depending on the age of the children, our high school and college age youth, and our elementary, all of them. A feeling of anger, and looking at that video, wondering, well, that could have been my dad, or that could have been my mom. That could have been me. Am I the next person? So confusion, sadness, anger. Now I'm seeing and hearing more hopeful, more energy, but still I'm hearing about being exhausted and some depression, because they're missing a main component is friends. Friends are what, keep us going. Friends are who we hang out with. Friends are who we laugh with. Friends help us know who we are.
So how do we explain the protests, the revolutionary aspect of this? How do we explain to our children the whole concept behind Black Lives Matter and the fact that we're not trying to set them up to be killed or to be murdered? How do we explain that?
Right. Well, first of all, we have to acknowledge what this is. And we have to talk to our children. They are picking up all this energy, and they are picking up all of our feelings with them. So we want to listen and we want to talk to them. And based on their history and their age and their needs is how they're going to view things. Some children who have special needs are going to see this differently than those, say, a 4-year-old. But we do need to affirm the reality that this is an upside down world. It's crazy. Don't nobody know what is happening. But for Black parents in particular, we must talk to our children. We must share with them that we are here to make sure that they are kept safe. Safety is our number one issue. So that they are safe. Black parents must talk to Black children, mixed children, children of color. You got to talk, give them the talk. This is the talk that we all give to our children. And it starts really very early in their elementary school. Things they need to do to be safe, how they have to protect themselves. And we can talk, they can hear us talk about the old days when we talked about the Klan and how that our ancestors got through this and those kind of stories, but how we made it. Also, we want to acknowledge that this is scary and that there is anxiety and there is some fear, but they have to stay safe. I have a granddaughter who's in college, and when this Ku Klux Klan and all the white supremacists were coming on campus back in the fall, talking to the students, and we said, you have to be careful and make sure you don't go anywhere out at night. Always be together with friends. There's things that you have to do to prepare them to keep themselves safe. Also, white parents need to talk to their children about racism. They need to know what it is so that all of a sudden they're not surprised. And now they understand that this is racism and what it looks like. It's like the bad guys and the meanies and the kids that jump on other kids. And, you know, you teach them about how to be helpers and how not to allow people to come and do mean things. Another thing is to share stories about the marches and our way of surviving and how they listen to me talk about marching with Martin Luther King. So when we went down to protests, they understood what that was about, why we were marching, what we were doing with it. Another thing is to know patterns of oppression, and it starts young. So they need to know that in this world, there is that feeling of stereotypes, and they need to know that who they are. And you can instill that in them as young as possible.
Okay. One of our questions is, how do we know when children are having a mental health crisis versus experiencing normal feelings of anxiety?
Right. Well, again, depending on the child, what with pre-existing kind of things going on with that child. But more, it's like the behavior changes to extremes. And sometimes it's masked. Kids who are depressed may look angry. They may start fighting. There may be withdrawal. They may have tantrums. Just my 6-year-old just got out on the floor and started crying. And we didn't know what it was, but I said, just leave him be. He couldn't have something that he wanted at that time. But now that his routine is all messed up, he doesn't have the patience to wait. So I got to have it right now. Mm-hmm. Mama won't let me. I'm truly deep down in my heart, I'm missing my friends and I'm missing my routine. And if I have special needs, I'm missing that kind of teacher and that kind of special person that has been with me, and now I don't have that. So we want to look at, and I advise people, if they get too hyper, even more hyper than they used to be, if they're crying more, if they're withdrawing and not wanting to come out. A beautiful way to get to it is give them drawing. Let them draw. Let them draw their feelings. Let them tell you stories in drawing. Let them make up a story. All this pretense, because that's where the feelings come out. And then we can sit down and talk about what those feelings are.
Okay. And Dr. Freeman, are you seeing any of this manifest physically? Are kids saying this hurts me more, and you're doing the exam and find that really physically nothing's going on? Are you able to notice that?
Yes, we've definitely been seeing that. I think that's one of the maybe not underreported, but things that hasn't been talked about as much with this pandemic. We've been seeing a lot more kids with things that are really related to their mental health more so than anything else. Being disconnected from the resources that they would have had in school, being disconnected from their friends, and having kind of more somatic complaints, abdominal pain that
Right.
is only associated with parents leaving the house, or different things like that. So I think it's really important to be in tune to what a child's complaining about. I would say healthcare providers, we are here, we're still working and we're open. So if you're having concerns, to reach out to your provider, to your pediatrician, try to figure out what's going on.
Okay. Another question from our audience. How can we help our Black children address questions from their white friends about the revolution? And that's open for both of you.
Wow.
So, Dr.
Well,
Ham?
I think it's part of the history lesson, It's part of what we've been doing. It's taking it straight on and looking at this as a transformative time. And we have allies that we didn't know we had, and sometimes, but we've known we had them because we've had those friends over a long time. So explaining to them what is our history, what has happened to us, where we're going from here, what we've done in the past to get through this kind of thing. And to say, yeah, come along with me. So you'll see people going, you saw high schools going down to the protests. So here's Black, white, whatever, all together for a common goal, and that is freedom and release of oppression.
I would agree that sharing their experience, I think one of the things, as I've talked about this in a healthcare setting with my colleagues, I think sometimes just the recognition of differences and the impact that systemic racism can have is not apparent to everyone. I've shared some experiences that I've had in the healthcare setting, but I've also heard some kids telling or talking about how they were followed around in the mall and their white friends had no idea that anything like that ever happened. So I think sharing the reality of experience is a great tool.
That's right.
Okay, thank you for that. And in talking to kids and parents, and this question is for both of you, what are kids wishing for the most during these summer months and as they prepare or possibly prepare to go back to school this fall? And how can we help them adjust to what some are calling our new normal?
Well, I'd like to respond to that. As human beings, we have thrived, and especially as Black people, we have thrived through all the things that happened in our history. There's some common elements, and I'm gonna list them. Fresh air. We need fresh air so we can breathe. We need clean water and lots of it. We need healthy food and not artificial food. We need a garden and to play in the dirt, to be in the dirt, to raise the food, just to feel it. And we need our friends. We need to be around friends. That's what the kids are telling me. I miss my friends. It can be set up in a way that's healthy, depending on where you live. What is your home environment? Is there a grandmother living in this home or a grandfather? You know, what are the parameters that you can develop your summer? Also having fun. Here's something else that we have survived by exercise. Exercise. Kids want it. They need it. Exercise. And to be in nature and to get out of the city, to go to the mountains, to go to the lake, to see beauty, to see God's beauty. Also time to be alone, time to meditate, time to write, time to express yourself. They wanted arts. This is from my granddaughter. We need to have arts. We need to have dance classes. We need to have step classes. We need to have spoken word. We need to have poetry. We need to have theater in the park. We need to have open air church where we can just We need to party. They want to laugh. And there's new stuff that's coming that I can't even tell you because this is a new time. So these kids are going to come up with some stuff we don't even know about.
Exactly, exactly. And Dr. Freeman, in our last 2 minutes, is there something that you would like to add?
Yeah, so I think I echo everything that Dr. Hamlett just said. I think what people are craving is connection. I hate to always be like, but be wary of this. I think as we've been using different tools for connection, so whether it's a Zoom chats or Facebook or all the other platforms that exist, recognizing that kids are using these as well, and that there are things and ways that they can connect that aren't as safe. So being very aware of this, the dangers of social media, the fact I learned recently, I didn't know you could meet people through Snapchat, which I was amazed about since I don't use that one. So just thinking about the safety things that also go with that, I think is really important, and just trying to help kids connect in any way that they can.
Okay. Well, we're at time, and I want to thank both of you for your dedication to our youth and that passion that is just burning through you to make sure that our kids remain healthy on not just a mental health front, but also physically, that we're making sure that our parents don't neglect the total child, the whole child. Because we're whole people and have some of those same issues as well. So with that, again, thank you. And this video will be available along with other information on the center's website at caahealth.org. And next week, our Facebook Live Lunch and Learn will focus on workforce development. And that workforce development will include not just our adults, but will also include our youth from 14 and for our purposes, 14 to 25. And we'll look at how to overcome some of the challenges many people are facing with unemployment. So they'll be talking about resume building. They'll talk about job experience, lots of different things. So again, join us next week. I also want to say thank you to these special women, and thank you for joining us, and we will see you next week. Bye.
Bye.